Hello viewers, welcome to Urologists on Air. So we have a very eminent urologist across India. So we are going to ask some of the questions to him and we are going to discuss a few topics to him. But before everything, I would like to request Sir to please present your introduction to the viewers.
Namaskar. I'm Dr. Sanjay Pandey, serving as the head of urology at the Kokilam Dhirubhai Ambani Hospital in Mumbai since the last 15 years. 24 years into urology, looking into quality of life issues on one side and to life-threatening disease on the other side. It feels good to be on a platform of this kind which has got a very holistic kind of ways of taking the subject awareness to the next level. Thank you for having me here.
So my first question is related to BPH. So basically what we are doing, what our viewers to get some of the knowledge related to BPH, they want to know. So my first question is, these days BPH is on very high risk and most of the people are diagnosed with it. So what is the reason? What are the factors that cause this?
BPH is about a prostate undergoing a hormonal change in mature middle ages of life. So in 40s, 50s, when the prostate undergoes a change, which is without your and my permission and without our knowledge, like my black hairs are gradually changing into grey and I don't know much about it. It's a millimeter by millimeter change of the prostate which undergoes a hyperplasia or change in the number of cells, and then increase in the size brings about changes in the urinary passage very gradually. So for all men in the late 40s to 80s, the progression of change in the prostate will not be visible by a benchmark like a fever or bleeding. It's a progression of change where the prostate can bring about obstruction to the flow of urine and nobody would escape it. If you escape in 50s, you may probably land up in 80s with the same trouble. So the awareness today from this wonderful platform is to look at, अगर हम 40, 50, 60 के हैं और हमारी प्रोस्टेट अंदर चेंज हो रही है तो तभी पता चलता है जब आपकी सोनोग्राफी होती है जिसमें दिखता है कि प्रोस्टेट की साइज बढ़ रही है. पर साइज इतना इंपॉर्टेंट नहीं, इतना इंपॉर्टेंट ये है कि आपकी पेशाब की धार कितनी अच्छी है, कितनी खुल के आती है, आप पूरा यूरिन खाली कर पाते हैं कि नहीं कर पाते. और बहुत बार ये हम सबसे होता नहीं है. 40-50 साल के बाद प्रोस्टेट एक हार्मोन रिलेटेड ग्लैंड जो अपनी चेंजेस ला रहा है, उन चेंजेस में शनय शनय ये चेंज होता जाएगा कि पेशाब की धार गिरती जाएगी. उस जमाने में जब हम बचपन में स्कूल में थे तो दीवार तक पेंट कर पाते थे यूरिनरी स्ट्रीम से, वो धीरे धीरे घटता जाता है और दादाजी की उम्र में वो पाँव पे गिरता है या ड्रॉप गिरता है. ये चेंज के बारे में जानने की जरूरत है. मेनी टाइम्स इन अ पब्लिक टॉयलेट a man would be emptying slower, will take time to start, time to finish and may not finish. If you are one of them, then see your urologist at the age of 50 and beyond. You should have one friend in a urologist who would pick up things earlier than you, rather than the health checkup. So prostate change will happen. This is a more common direction of change. हाँ, prostate enlarge होते हुए या न enlarge होते हुए बाहर से enlarge अंदर से होते हुए धीरे धीरे urinary passage को block करता जाएगा. So it's an epidemiological phenomena. More and more people are aging gracefully, and with graceful aging comes all those issues where obstruction will become a part of life. Then you will learn to adjust with it, and that adjustment is not acceptable. So basically, it was to tell our colleagues from this wonderful platform that obstruction to the flow of urine, the commonest complaint that elderly men give, is also seen in youngsters, in younger men. If you pick up early in time, there are medications today of very highest level in science and evidence where we can reverse the entire aspect of bringing the prostate size down, improving your flow, and going with the flow of not letting the prostate trouble you when you age to a level which is different from what you know today.
Sir, when it comes to cure, I would like to add one more thing to it. I just wanted to know that when does surgical intervention become very necessary and how to avoid it? बहुत सही. So surgery for surgical diseases is almost a requirement because it brings you a cure. Is there a cure possible? Yes. In prostate diseases in men where the prostate is enlarging and obstructing, medical management of combined aspects जहाँ पे urinary flow improve हो रही है, prostate को shrink करते जा रहे हैं, ये जो कोशिश चल रही है, इस कोशिश को अगले लेवल को ले जाने की एक और तरीका है, जहाँ अगर आपका flow improve नहीं हो रहा है, you are the one whose prostate is occluding completely, your bladder does not empty, the bladder is shouting खोलो खोलो खोलो, लेकिन occlusion obstruction हट नहीं रहा with medical management. In other words, scientifically, somebody who is refractory obstructive voiding not responding to medical management. Somebody who has inched progressively to a point in जहाँ where he goes into retention of urine, जब block होते होते एक दिन फिसल गए. Somebody who is having a high residual volume which almost does not empty, he forms bladder stones. बहुत बार bladder decompensates and the kidneys suffer, which is called as bilateral hydroureteronephrosis in medical terms. तो जहाँ दवाइयाँ काम नहीं आ रही हैं, वहाँ treatment हो नहीं पा रहा तो क्योर जाते हैं. That your doctor will decide. A urologist is qualified to identify you and score you and look at the evidence that you're not improving medically. तो अगर हम medically improve नहीं कर रहे हैं,
then surgery becomes a choice where we take a telescope, enter your urinary passage smoothly enough, clear the occlusion and obstruction, let you heal over the next few weeks, and you're back to your childhood days where you can paint your urinary stream onto the wall.
Sir, next question will be related to overactive bladder. So this is one more very common question related to the viewers, and many of the patients are suffering from it. So I'd like to throw some light on the same topic, overactive bladder. So can you please describe for the audience viewing this that what is an overactive bladder and how does it impact the quality of life of a patient?
Well said. Friends, overactive bladder. Normally bladder is active. जैसे heart is active 72 times per minute, bladder is active. Bladder, you should be blessed that bladder is receptive enough. हम और आप बैठे हुए हैं और आराम से bladder बढ़ती जा रही है किडनी से. जैसे जैसे bladder बढ़ती जाती है, sensation आता है and that sensation makes you go and washroom and empty your bladder. Imagine if the bladder has got excessive sensations, overactive. शैतान बच्चे की तरह बार बार contact कर रहा, you can't hold urine out. So the inner lining of the bladder senses, the outer lining of the bladder relaxes and contracts. So in the Indian guidelines talk about 9 to 43% of Indian individuals, more women than men, more elderly than youngsters, go through this progressive change which is sadly a lifestyle phenomena for them, where the bladder becomes a shaitan bachcha. It just contracts erratically. आप queue में हैं, आप exam में हैं, आप aircraft में हैं, and suddenly bladder ने contract किया. So three components which define overactive bladder is increased frequency of urination. The bladder is more sensitive right now. Urgency, a purposeful desire where you can't postpone urination. It's like a precipitancy. जहाँ अगर आपने postpone किया, then you can have the third component called urge incontinence. So for me at this point in time, somebody who is going through increased frequency of urination, who has got a gross urgency which is almost amounting that he has to rush, or he has to adjust himself by drinking less water, finding public toilets or wearing black garments ताकि पता ना चले, and sometimes or many times a week leak urine, are people who have got overactive bladder. Remember, overactive bladder can happen in any age group. It's more commonly seen in elderly people. It's more commonly seen in signal phenomena in women where they have other kinds of incontinence too. So overactive bladder is treatable. It's a knowledge that we need to have, otherwise sadly people adjust to it, drink less water, have a very highly concentrated urine, wear diapers, etc., etc. So it's an overactive bladder awareness from this wonderful platform which will make many people go to their urologist. Remember, only a urologist can do a job in overactive bladder. He needs to define, identify and stabilize you towards the cure.
Sir, what is UTI? Like, I wanted you to throw some light on UTI. It is very common these days, and how it's correlated to kidney stone.
Okay, so UTI or urinary tract infection, it's a diagnosis which is made on the language of a patient. How does it mean? Urinary tract infection is where somebody complains. He doesn't complain of stone or a kidney cancer, but he complains of urinary issues. So what are the urinary issues which comprehend to make us understand that हमें urinary infection है? Burning sensation when the urine comes out through the urinary passage, increased frequency of urination because there's an inflammation or an infection in the lower urinary tract, which is urethra and the bladder. There is a discomfort when you pass urine, which is a spasm or a pain or a pida. So there sometimes can be a fever when it becomes a systemic disease and the disease can go to the kidneys. So urinary tract infection is an infection which happens to both men and women, but more commonly in women. Only because of the kind of anatomy that the women are made up of, where the urinary passage opens close to the vagina and the rectum. Vagina and rectum are storehouse of bacteria as normal commensals. These don't have lock-in keys, so the bacteria do come out from the urinary into the area of the introitus, and the urinary opening in a woman is always in an area of contamination, and therefore hygiene is something very well required for all women compared to men. Men have a urinary sexual passage in the male organ. If they are circumcised, they are more hygienic compared to non-circumcised tight phimotic prepuce जहाँ पे skin पीछे करके साफ नहीं कर पाते. So UTI can be preventable. Some people can get recurrent UTIs. Your urologist has to identify the cause. UTI is the end result of something happening. Smoke is the end result of a fire. So we need not quench the smoke, we need to find the fire. Very important for us to identify the reasons of UTI, treat them accordingly and probably take it forward. There is one kind of a stone which is called as a staghorn stone. That's a complex stone which happens in the kidney very silently. This stone in the kidney could be an infection related stone, an infectious stone. So they have actually got tomb house or bacteria and the whole thing has grown silently as infection stones. Otherwise, stone may not have a direct relation with UTI other than only this staghorn stones which are actually infection related stones. So UTI, as you rightly said, is a common phenomena. Women more than men. hygiene underscores anything around. So hygiene has to be a part of life. Remember, there's a religion where a woman cleans up herself 3 to 5 times a day because she has to do namaz. So she is more clean than the other religions only because the hygiene is being maintained in an area where bacteria is contaminating from the rectum and the vaginal passages. So UTI can be prevented, UTI can be treated. Not treating a UTI, sadly, with complicating factors like pregnancy, stones, obstruction, can lead to an ascending infection to the kidneys and sometimes to a urosepsis. So don't take UTI lightly. For your UTI, kindly see a urologist in your city, and urologists are competent enough to pick up the cause, treat you, prevent a recurrence, and to cure you from this rather than looking at just taking medications and antibiotics.
Thank you so much, sir, for your precious words. Thank you so much, all the
Thank
best.
you.